Hey, what's good, everyone? It's Jody here, your Wednesday host for FT Realm, and this week we are talking about therapy versus informed consent. And I think both options are really good. It's just going to really depend on what an area has to work with and what you have to work with. Um, I kind of went through therapy slash informed consent. It was kind of combined package deal. I didn't see my therapist is actually a psychologist that works at the university that I go to. And so when I first met her, I met her through a couple people that I did panels with over the course of a few months. And um, upon scheduling my first appointment with her, we talked a lot about my background, my knowledge on hormones, what they were going to do to me, what I wanted to do in the future, like with career wise, with surgery wise, if I planned on moving, my support systems, like friends, family, if I was in any intimate relationships. And at the time, I wasn't in any intimate relationships, but my family and my friends were completely supportive of me, so that was really cool. And since I had been thinking about transitioning since I was like 19, um, I did have a lot of knowledge on what hormones were going to do to my body, what I wanted them to do to my body, and just kind of overall my childhood on how I perceived myself throughout everything. Um, and so through that conversation there, which was a few hours long, 2 to 3 hours long, I want to say, she said that she would definitely write me a letter because based on my knowledge of everything, of surgeries, hormone effects that were going to take place in my body, along with having a really good support system, having a plan in place for a career and everything like that, it seemed like I was, pretty good to go. So, but she did tell me that if while taking hormones, if I ever needed to see her again or anything, to let her know if anything came up where I needed to talk through some things, with my transition and anything like that. So it kind of was a little bit of both. I would say more along the lines of informed consent, but that was because she has handled trans people before. So she, knows about everything and is knowledgeable herself, and her comfortability level is really high. Now, some psychologists, some counselors, things like that might not have that experience. You might be the first person that they're ever having this conversation with. And so it can be very frustrating on your end when you're like, I know what I want to do. I just want to go. I just want to go. I just want to go. But they're trying to make sure that they're doing the right thing for you, along with doing the right thing for themselves as professionals. So I don't think that therapists or counselors that take longer periods of time to write a letter are necessarily gatekeepers, as some people call them. And it's just, they're trying to make sure everything is set. And that's pretty much about it. Some people want to, get to know you a little bit better before they're like, all right, cool, let's jump into this. And some people are like, no, I'm comfortable doing this, so we'll just do this. I've never, had a bad experience, blah, 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 blah. You know, everything's great and dandy, but not every professional is the same. And we have to recognize that not every professional is the same in regards to writing letters and everything and comfortable with handling trans people. Some professionals will try um to work through like maybe their uncomfortability, and then sometimes it doesn't work out in the end. I've seen that happen. But I mean, if you've been talking to a therapist, counselor for a long time for personal reasons or anything like that, definitely don't be afraid to bring this, topic to the table. They know you, they've, been around you. Sometimes it's harder to start all over than to just continue on and kind of go through a rough patch and take a little bit longer to start hormones. But I mean, in the end, it's everyone's decision. But you have to understand that you might want to do some research in your area on, who or if, there's more people out there that are willing to handle the trans topic and writing letters, and if there are any doctors, because what a good thing is that a professional can kind of network for you rather than you making phone calls and going, hey, do you prescribe hormones? Would you do this? Would you do this? And that can get very frustrating on your end, and it can bring you down, 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 lower that self-esteem. And a professional can do that because it's not going to hit them personally, where you could take it more personal than maybe, your friend or your mom making that call for you. And so they can do some networking for you, try to find out if there's anyone else in your community that would be willing to see you, would be willing to monitor your hormone levels, doctor wise, prescribing those hormones. And so altogether, eventually it can come together, but you just have to be patient enough to see where it's going to go. But I don't think there's a downside to either end of it. Informed consent does seem to go a lot faster, whereas therapy can take time. It doesn't necessarily mean it's going to take time, but it can. And so you just kind of have to weigh things out for you and your situation and see what else is out there if you're not willing to maybe wait a little bit longer to start hormones or things like that with a therapist. So it just really depends on you, your comfortability, their comfortability, and what's gonna kind of come together for you in the end, and if that's even doable to do kind of an informed consent situation where it would be a lot faster. So I hope that this kind of helps everybody out, and I hope that you guys have a good rest of your week. Talk to you guys later.